Madam Speaker, I have an amendment at the desk. Amendment 743526-1.
Amendment number 1.
Move so much be considered the reading of the amendment.
So order.
Thank you, Madam. Thank you, Madam Speaker. Colleagues, I just want to address some of the issues with this bill, and I think this is obviously a well-intentioned bill. We want to de-escalate every single interaction we possibly can with law enforcement because we want positive outcomes with law enforcement wherever we can. The concern is, so when I was in law enforcement a long time ago, 100 pounds ago, and 20 years when I was in the Marine Corps, always the worst interactions we would ever have were domestic disputes, right? And even though most of these individuals did not suffer from mental health issues, they were in distress, as most people are when they're having to call 911 and call law enforcement. And we would walk into a variety of circumstances, not knowing what's going on. Obviously, stories would change from the time that the 911 call came in to the time that we would arrive on scene. And even the best 911 dispatchers on the planet cannot see through the phone line to see exactly what's happening and understand the nature of the call, the individuals that are upset, especially if an individual has a mental health crisis. They may not give a full and accurate picture of what's happening on scene. Additionally, in this bill, it's clear that we're trying to reduce law enforcement responding to these type of calls. I'm concerned that puts tremendous pressure on the 911 operator to meet the will of the General Assembly. These 911 operators right now are under enormous pressure, just dealing with the calls that are plain to deal with, people in distress, emergencies, people dying, elderly, all kinds of issues that these folks are having to respond to, and the mental health crisis that currently exists amongst our 911 operators. Now we're going to add an additional layer to them to have to determine whether or not I send law enforcement to a call and potentially not meet the will of the General Assembly. I think we're creating too much pressure on these good folks that are doing God's work right now, responding to these 911 calls. So all my amendment does is require that law enforcement is dispatched along with these crisis response teams to a call. It does not mean that law enforcement must interact with the individual. It does not mean that law enforcement must use codes in responding and make a big scene. But law enforcement's job is to evaluate for the safety of these crisis response teams when they're responding to some of these very complex, very difficult calls. I think the burden that would lay upon a 911 operator who's forced to make this very difficult decision to send a crisis response team in without law enforcement support, right, and gets killed at a scene because the 911 operator is trying to meet the intent of this law is terrifying. And I don't want to accidentally and unintentionally contribute to the mental health crisis amongst these 911 operators. All right? So I think this is a good amendment. It's a friendly amendment. It helps support the goals. It does not mean that, again, we can still put together these plans and build these plans around reducing law enforcement's interaction on these calls to minimize and again, the floor leader is absolutely right. Sometimes law enforcement can provoke some of these individuals. So we certainly need to work towards plans to reduce that. But at no time, for all these reasons, should these folks be dispatched alone for their safety, for the safety of individuals they're reporting, and also the safety of the individuals this individual may be interacting with, where they may be risking the safety of others. So for all those reasons, I urge the body to support this amendment. Thank you, Madam Speaker.
Vice Chair of the committee.
Thank you, Madam Speaker. And I thank the gentleman for providing the amendment ahead of time. I really appreciate it. I would say that this is not a friendly amendment, with all due respect, and I would ask the body to resist it for the following reasons. If you look at the bill and you go to the reprint, bill page 6, line 25, it's very well thought out, the process at the front end with the dispatcher, the operator. And it says, each public safety answering point shall develop a written policy on the procedures to be followed by the public safety answering point when a call is received that involves an individual suffering an active mental health crisis. The written policy developed under this paragraph shall, is not discretionary, it is mandatory, shall include the procedures to triage a call involving an individual suffering an active mental health crisis. That means that they're trained to ask questions, to make sure that they ascertain what the situation is. They can't see, but they can hear, and the training allows them to get a picture of what's going on before they decide whether it should be just the police or whether it should be a mobile crisis team that is designed primarily to respond to the calls from the police officers that are on police radios, and they are able to tell whether, this is appropriate or not. The bill on page 7 goes on to say that the dispatcher must look at the resources that are available to dispatch. That means that in the training, they have been told what those resources are in the community to help an individual that has a mental health crisis. This is not a call that involves a murder. It is not those traditional charges. They're trained to recognize this. It goes on to say that they shall also include the procedures for making a dispatch decision and training for applicable staff on implementing the procedures. So I would say that these operators get training, they're taught what questions to ask, what kind of scenarios to look at. And again, I will say that your amendment, while well-intentioned, and I appreciate it, it goes against the best advice that our experts give us, that in cases involving mental health crisis, it is best to limit the presence of the police. And the bill does that. And I will ask the body to follow the science and follow the recommendations of our experts. And I would ask the body to vote red on this amendment.
Madam Speaker.
Maker of the motion.
Thank you, Madam Speaker. And again, I appreciate the floor leader's work on this bill, and and I agree with much of what you say. My concern is this entire bill is predicated on the individual who's potentially suffering a mental health crisis being clear and giving honest answers about the circumstance. And we're assuming that there's not a murder on scene or a violent crime on scene based upon the answers of an individual who is suffering a mental health or even possibly suffering a mental health crisis. So the amount of pressure and liability we're putting on certainly the 911 operators, certainly the amount of pressure we're putting on the crisis response team showing up into a situation that may be dangerous and they have no idea, and all they have to go on is the answers of an individual suffering a mental health crisis. Let me repeat that. The only information that we have been making this determination is the answer of someone that is suffering a mental health crisis to determine whether or not it's safe to send one of our good mental health providers in unprotected to a potentially dangerous situation. And all my bill does is just require that law enforcement at least accompany them. They can hang in the background, they can evaluate the scene and make sure it's safe before they send the folks in, but these folks at least need the backup to help protect them in case they're walking into a dangerous situation. So I please urge the body to please support this very common sense, very good intentioned amendment to strengthen this bill. Thank you, Madam Speaker.